again repeating myself, to Waste Watchers Cornwall, an informal group of people to share ideas and challenges in the world of waste and recycling. And I'm going to share my screen. I'm going to zip through some slides and then we can have a chat. But I might do a bit of sharing and then stopping and sharing and stopping. So just bear with. So we've done our introductions and I am recording. The topics, couple of topics today, just new tiger bags, any feedback, and just that was following on from last month, the last session that we did, and a little bit about sustainable procurement. And I will confess that I have very limited expertise, so I basically do research and then present it to people, and it's all about sharing and finding good ideas that I can share with everybody here. So we are, everybody in primary care interested in waste and recycling. It's all about sharing best practice and sharing the challenges, and maybe if we can put our heads together to work around things, and then creating the conditions for contagious change. And it's all about peer support and helping us work through any problems. So the next meeting is going to be in January on the 13th, and it's normally every other month on a Tuesday. We just had to shift it this time due to other commitments. So a little bit going backwards to the last time, we had a presentation from Isabel from Anenta, and there's a YouTube recording of that full meeting, and the presentation was all about the move to tiger bags. So this is for, and I would be keen to hear from anybody who's on the call about their own experience about the move to tiger bags. So it's the shift from orange only to, hopefully for general practice, just having the tiger bags, the black and yellow bags, instead of orange. The idea, I think, was the message from Isabel last month was to not duplicate and have more bins, but it was to switch to just having tiger waste. And the reason being, there's lots of reasons, but it's about how that's dealt with. So it's all collected, and then the tiger bags, because they're offensive waste rather than the orange ones, they go to an energy from waste centre, which is at a lower temperature, so better for the environment compared to the orange bags. So that saves money, 3 times less money for those tiger bags, which saves money for the whole ICB system, but obviously it's better for the environment as well. And literally just before this meeting, I've had a few resources from Anenta. So this is a poster that I'm happy to share and we'll put on our website and so on. Just again, a visual reminder of what should be going into those offensive waste bags. So I'll just stop sharing for briefly if anybody would like to share, and I'll just check in the chat. Apologies. Okay, so I'll move on if nobody's got anything to share about that particular topic about the clinical waste management. Okay. So the other topic, which again follows on a little bit from last time we heard from Spencer as well, who's just stepped away, who's on this call, about the changes that he'd made. And it made me thinking more generally about sustainable procurement. And just wanted to briefly share the findings I've got. I'm not going to read this out, but it is really thinking of what sustainable procurement is in a broader sense. So it's thinking about the things that are purchased, thinking of them in a broader sense, so that they are benefiting not just that organisation because they need those particular items, but to thinking broader to the environment and to wider society. And there's 2 kind of main sources that I found, and if you've got other sources, if you've got information you'd like to share, please do pop it in the chat. But my 2 sources really, and I was thinking that we might have some people from community hubs today, so I've included this Green Footsteps guide, and then my source for looking at primary care is from the wonderful Matt Sawyer, who's got a whole guide and is there to support organisations. So if you're working in a GP practice and you need a little bit more support, I would signpost you definitely to contact Matt, have a look at that guide, and then he'll be able to, if you get in touch with him, he'll be able to help work through some changes and a wider sort of sustainability policy and so forth. So why do we need to talk about sustainable procurement? This is stating the obvious, so I apologise if I'm insulting anybody's intelligence, but it is just sometimes good to reflect and go, why are we talking about this? So whatever we get, whether it's a good or a service, it has a financial and environmental cost as well as the social and wider costs as well. Everything that's bought is going to be consumed, and then there will be a waste element to it. If you're working at NHS, there's lots of drivers to sort of encourage the move towards sustainable procurement. And then more generally, if you're not in NHS, it's just very good business practice. It leads to longer term financial sustainability, and it also raises ethical standards as well. And obviously, I'm thinking of it from the climate resilience team, from the environmental side of things. So it's all about reducing, which is what we talk about a lot in this particular group, reducing before we think about reusing and recycling. So you've probably heard the phrase, the whole life cycle approach, and this image shows it quite nicely here. So it's again, this is a real whistle stop, just a snapshot of to get us thinking and talking about it. It's raising those questions. Do we need this stuff? And how much of this do we need? Can we find reusable items instead, which is what Spencer did, talked a lot in detail about what they'd made, the changes they'd made in Probus last time we met. So can you find refurbished items? There's lots of, for example, mobile phones. There's lots of organisations now, companies, where you can get your refurbished, reused mobile phones and laptops, etc. So tech, I think, is one area is worth sort of looking at. And then, if possible, finding local suppliers to think about that whole life cycle approach and minimising the impacts. And I have seen in some of these other images and some of the documents, you'll see this kind of diagram shown more as a circle, to think of it as the cycle and the circle. So the circular economy is another related topic, thinking about instead of cradle to grave, the cradle to cradle. So whatever is at the end of that item's life, it can be introduced into resources again. So one little tiny example is from just anecdotal from a practice manager in Stenwick. There was a new practice manager started and it's lovely Sheila in St Ives. So she came in new eyes on the practice and was concerned about the procurement situation. So she did an audit, looked at where things were being stored and where there were gaps maybe, and where there was overordering, where there was out of stock items. So did a bit of a clear out, and they did a stock take in each room and just tightened everything up, and that improved the efficiency to only order what's needed. So they then moved everything to a central cupboard. So although obviously that might involve a change of behaviour for the people working in that practice, I think it went down quite well. Probably similar to Probus when Spencer shared this last time, where if it's from the team and the team are on board with those changes, and if it's managed well, then they welcome it and can see the benefits all round, really. So that's one mini example of what worked well in a surgery in St Ives. So another thing I just want to raise is the NHS supply chain. I put a question mark here because I know very little. I just went on a webinar and heard about NHS supply chain, and I'd be really happy if people jump in and say a little bit about their experience, because I'm literally just sharing things that I've heard on a webinar. And I heard that the primary care use of NHS supply chain is quite low relative to acute trusts and other parts of NHS. So the most common in primary care is that it's used for wound care, and the information that was shared on this webinar about the benefits of the supply chain is that the suppliers that are supplying to that need to have a carbon reduction plan, and that obviously is then instead of the say, the practice manager having to investigate, is this supplier got a good, carbon reduction plan? That's all done for them. So it cuts out maybe that little bit of the work element if you're trying to do some sustainable procurement. There's for acute trusts at the moment only, there's an inventory management programme. But it was interesting to hear that from the NHS supply chain, 25% of the carbon emissions are from just 6 suppliers. So it's something they're looking into. They're working hard on it, looking at scope 3 emissions. But their message really to on this topic was about buying less, buying better, and buying different. So just making those changes that we talked about and heard from Spencer last time. So the next bit, a part of this really, I've mentioned getting reusable equipment as part of it, as part of that sustainable procurement process, buying less, buying reusables. And I'm sure I've talked about this before, tourniquets. The only examples, the bigger examples where there's sort of some more detail and some research element to it have been in the acute trusts. So it'd be really interesting to hear more from any primary care practitioners that have got experience of this, and just to hear, it'd be interesting to hear if your practice uses reusables and you have been for years maybe, or whether it's a new thing and you're thinking about switching. Just be really keen to hear where people are at in terms of reusable tourniquets, or if you've had any experience at all. So the co-benefits from this particular study, which was up in Sheffield, is that there were social benefits, there were clinical benefits, that the patients actually preferred these reusable tourniquets, and then there's financial and environmental. We've got some stats there on the screen to show the benefits. And this isn't the only trust that's done that. There was another case study in Yorkshire, and I'm sure there's lots more. I've just plucked a few examples out to share today. So please do butt in if you have got any comments or questions. I think there's been some questions over the cost of reusable items, and whether the PCSE supply disposables kind of automatically, or whether that's an option. So again, we are in conversation with ICB colleagues to make sure that those options are available for clinicians in primary care. So just flicking back to my chat to make sure I'm not missing any questions at the moment. So other reusable equipment. Now this is again one particular area where items can there's a choice between something that is single use as opposed to reusable, and I think anecdotally I've heard that these reusable compression bandages are in use. So again, I'd be keen if you're watching this after the recording, do drop me an email and let me know how you have found these changes. But I found from one of the obviously there are lots of different brands out there, but from one of the companies that provide these, they gave me the information that if a patient is using single-use bandages, then the nurse has to visit them at home, sometimes 3 days a week, and that might last for 6 months. So there's a lot of visits to home, a lot of the greenhouse gases emitted from that travel. Obviously, there's the time that the nurse is taking to do those visits, whereas the compression, the kits that can be applied by the patients themselves and will last for 7 days rather than every few days, will be a preferable option. So lots of different benefits. Again, it is cheaper over time because they're lasting for longer. The environmental benefits I've already mentioned about the home visit impact. And then also the staff, I think, are recognising the importance of using a reusable item. And there's lots of support for patients. So it's not like, here you go, there's your kit, off you go, see you later. There's lots of videos available, lots of support online for patients. So yeah, if anybody's got any experience about those, please do share. So I mentioned a couple of reusable items coil fitting equipment, I think, has been long used for many, many years in certain practices, but not everywhere. I think some trusts have trialled curtains that are reusable or more the old-fashioned washable. I'd be keen to hear about any other items, any other things that are being tested, or any things that you currently can't reuse or can't find an alternative that you are desperately hunting for, because that's something that I could, we can put a shout out and see if there are options that other practices have used. So yeah, really keen to hear more about any of that. So I will stop sharing my screen in a moment and answer any questions, but just to let you know, the next meeting is 13th of January. I am looking for topics. What do we want to cover? What do we want to chat about? And there's my contact details and a few websites that you'll find useful. So that's enough, I think, from me. The slides. I'm just going to check. Don't worry, Spencer, at all. You didn't miss much. Just me mentioning you quite a lot because you've done so many great things.
Sorry, I've got a million things going on at the moment.
Don't worry. You really don't need to stay around if you've got really important things to do. Don't worry, Spencer.
Okay, don't worry. I'm in between stuff, so I'm still here.
Okay. So any thoughts, comments, questions? So I've just seen a comment from, thanks, Mike. So for the purpose of people watching, Mike, can you come off mute and explain what you just put in the chat? Thank you.
Yeah, so I was just in the context of reusable devices. Obviously, our sterile services department services all of the surgical facilities across the county, and I've just been leading a project to upgrade that. So we put in a new clean room. There's a temporary clean room at the moment whilst the new one is being refurbished. But what that will do is it kind of improves the flow, the workflow in the space, so that more, and it improves the staff working conditions within that room as well. So basically we can process more equipment. So currently it's over 3 million pieces of equipment per year that go through that kind of facility, and it's just been upgraded and improved, so it will be able to handle more.
Fantastic. And is the turnaround fairly rapid in terms of things?
It works pretty much 24/7, and it's fairly kind of on demand. So yes, I mean I don't operate in for example Probus surgery hub who are serviced by the facility, but what we're hoping is that it will improve turnaround times.
Yeah, fantastic. That's really good news. Thanks for sharing that, Mike. I've worked with lots of practices that have used, especially the coil fitting equipment. I think that's quite a sort of standard one that then goes to the sterile service department at RCHT. So yeah, fantastic. So any other comments or questions about waste and recycling generally, or any of the things I've talked about, sustainable procurement and so on? Does anybody have a sustainable procurement policy in their practice as yet?
We haven't got a policy per se, but obviously, Annette, all the changes and all the things that we've kind of done here in terms of how much we've managed to save. Which is just getting bigger and bigger and bigger. I mean, I'll just share the screen again for just a few who haven't seen it before. Can you see that, guys?
Yeah, perfect. Thanks, Spencer.
So this is kind of, because obviously we've got a surgical centre, so it's slightly different to us, so we've got loads of opportunities where we can do it, where maybe some GP practices don't do as many ops and things like that, but as you can see, we've managed to do quite a lot of environmental things, and we've saved, it's actually closer to 60,000 now that we save in annually at the moment, just by using reusable options, basically, rather than using one-time things at the moment. So we're doing quite a lot of stuff like that, and that's worked really, really well. But it was interesting to learn that actually NHS procurement actually are really proactive in this. They've actually got 3 specialist people, haven't they, who actually look after this for you. which I felt a bit gutted about because I worked my ass off doing this myself, and then found out somebody could help me. But
And
actually,
that
they're
was a thought.
brilliant since I've spoken to
Yeah.
them, and they really, really do help. And you can phone them up, and they will go out and find sustainable procurement for you, without you having to rewrite it and do it yourself.
Yes. So when I was preparing this and looking back through my notes, like I said, I mentioned this webinar that I attended where NHS supply chain were talking. I thought, well, do we invite them? Do we maybe get them along to talk about that service? And given what you've just said, Spencer, I think I might contact and suggest that. But
I
just
can probably put you in
because
touch with the right person because they spoke at the National ICS meeting.
that's
So
right. Yeah.
I've seen all of that, and after this meeting,
Okay.
I'm happy to send you the minutes and the presentation stuff. I should have it here somewhere, so I can ping it to you if you want to have a look at it.
Yeah. That'd be great. Thanks, Spencer.
No
Yeah, I'm just
worries.
thinking again of how we make best use of these meetings so that we're reaching the topic areas within waste and recycling that are relevant to everybody. So yes, I think that was exactly I called it a webinar, but yeah, it was the ICS Leeds meeting back in August, was it, or July? Yeah, that's where I got that information from. So I think it would be worth inviting them because they definitely were keen to work more or to sort of spread the word about NHS supply chain for primary care. So I think I'll investigate that and see if we can get that for next year sometime. Because I think when thinking about this group and the waste and recycling, we've talked about clinical waste, we can talk about pharmaceutical waste and go into different areas, but I'm really keen to support that whole approach of basically it's just reducing. That's the first line of it is reducing, and that kind of can broaden into the whole health creation discussion. Yeah, I think using NHS supply chain could be one of those particular routes that like you said, Spencer, you weren't aware, hadn't thought of it. So and if you don't know, Spencer, then that must mean a lot of people because you know a lot of the great stuff going on. So yeah, I'll definitely pursue that for a future meeting to invite someone to come and chat about that. Okay, any other ideas for what you would like to cover in the future? Because I keep kind of doing what I think is useful for people and doesn't necessarily kind of hit the spot for other people. So picking up ideas is absolutely fine, Nicola. Hopefully we've given you a couple of things today just to think about reusables and about sustainable procurement. I don't think I mentioned a spot policy, didn't I? And like you said, Spencer, you don't need a policy to make these changes. It's just about having the time and headspace to think differently and to think. And the message I think I've again share from your experience, Spencer, it's about the whole team being part of the change. And you were when you were talking last time, you was explaining how it wasn't all you, so it doesn't have to be one person. The team were identifying things and the team were finding alternatives. So it was just, I think it's about maybe creating the culture within a practice or an organisation where those questions can be aired and those challenges can be made, and it's a positive challenge rather than a sort of a complaint or a concern. So
I think you're more likely to get buy-in from your colleagues and your staff as well if that happens. I think if it's
yeah,
all kind of dictated just downwards and things, I don't think you get the same buy-in and compliance with it. And the fact that the team did it themselves has meant that they police it themselves as well. Do you mean? So it's not really me who's doing this. And I think that's the proudest bit of it, because when I first started, it was all led by me. And now, I'll openly put my hands up and say all that work I was done on that sheet just now was done by my team. It wasn't done by me at all. Do you mean? So fair play to them. Yeah.
Thanks, thank you, and thank you, Mike. Mike's just put something in the chat which I will share with the slides and any notes. Did you want to add to that? Mike?
So yeah, I put that there, Annette, because I work on social value for the New Women and Children's Programme in particular, and do a lot around that. And it's always when you're spending public sector money and you fall under the public procurement requirements and regs, then social value is a really big thing. I'm not entirely sure how it applies to more localised primary care suppliers. You're not, if you're spending NHS money and you're spending contracts over a certain value, then perhaps those guidance notes do apply, and you need to seek social value when you're going into contracts or buying goods and services, but over a certain threshold. NHS supply chain, though, what I put in there really is a link to the page where their sustainability page, which talks about social value. And they essentially, when they are seeking suppliers, from whom I'm assuming they pass on the benefits, if you like, to yourselves as a primary care system, they are then scoring and asking for social value, which is, on top of the core contract. So it's also another way of adding more value back into society on a wider basis. But I guess if you're using NHS supply chain, you could probably also ask them what social value they deliver locally or their suppliers deliver locally, because you could associate your practice with that.
Definitely. Sounds fantastic. That's brilliant. Thank you, Mike. Okay. I am in the process of sharing lots of we've got a new website, and I'm in the process of uploading lots of information and lots of links to that under the heading of waste and recycling. So thank you for sharing these links and resources. I'll definitely make sure that they go on our website, and then probably next time I'll be able to show you what we've got, and show you how easy it is to search and find things. But again, I'm going to ask the question again. Let me know if you have any particular topics that you want to cover in the future. So our team works with primary care, but obviously a lot of these topics overlap into all areas of healthcare, wellbeing, and so on. So I'm really keen to I'm not going to hang around and keep waffling and keep talking today. We normally set aside an hour for these meetings, but I'm very happy. I'm sure everyone's so busy that if they get back a half an hour of their time, then that'll be absolutely fine. But I would just also encourage you, before I go, to use us as project officers. So if you are a practice working in a particular area, so I'm in the West, my colleague Martin works in the central area, and we have got Catherine now, who's our project officer in the north and east of the county. So if you're not sure which patch you fall into, go onto the website, do a contact form, and we'll work out who to connect you with if you're not already connected. But for those of you that have heard from us in the past, just ping us a quick email if you've got a quick question, and let us do a little bit of the donkey work in terms of finding out and sharing the great things that are going on. So if there's no other comments, no other questions, thank you so much for joining. Mike, it's been really good to see you, meet you, and hear about what's going on at RCHT. So thanks for joining, and thank you to Nicola. And we did have Andrew, who was here earlier as well. So thank you very much. I will stop recording and say goodbye.
Bye-bye.
Bye, Annette. Cheers, guys.
Bye.